All right, we're now going to be talking about section 2 of chapter 15 of the autonomic nervous system, now talking about the divisions of the autonomic nervous system. The learning objectives for this section are to be able to describe the general functions of parasympathetic and sympathetic divisions of the autonomic nervous system, compare and contrast the anatomic differences in the lower motor neurons and associated ganglia of the parasympathetic and sympathetic divisions, explain why parasympathetic activation is local and discrete, and sympathetic activation can result in mass activation. So far as functional differences, and you'll have to know these basic differences, this will be on your exam, that parasympathetic and sympathetic divisions of the autonomic nervous system have complementary functions. The parasympathetic division is the rest and digest division, whereby your heart rate is typically below 100 beats a minute, your blood pressure is low, your body, at least for normal, you're at rest essentially. There's not much stress at all. It's very little stress. That's when you're near homeostasis or at homeostasis, somewhere in that range. And your body prefers to be there whenever possible, as much as possible. It's when you're conserving energy and replenishing nutrients. The sympathetic division, the fight or flight, is there for when we need it. It's not supposed to be a place where you are to go too often. That said, it's for exercise, it's for excitement, times of excitement and emergency where your body needs to respond. As far as the anatomic differences in the lower motor neurons, you should definitely know the difference for your exam for the parasympathetic and sympathetic craniosacral division versus the thoracolumbar division. Otherwise, for things that just we need to know in general, for parasympathetic motor for the lower motor neurons, the preganglionic neurons are in the brainstem, or S2 to S4, the spinal cord. Those preganglionic axons are long. The postganglionic axons are short. The ganglia are close to or within the effector organ, and the preganglionic axons have a few branches. Whereas in the sympathetic, the fight or flight division, it has preganglionic neuron, a singular neuron, in the lateral horns of T1 to L2. The preganglionic axons are short, and the postganglionic axons are long. The ganglia are close to the spinal cord. They're either lateral or they're anterior to it. You will need to know that part for the exam. The preganglionic axons have many branches, an opposing difference between them and the parasympathetic division. Now, with the parasympathetic and sympathetic divisions, and comparing them here in the autonomic nervous system, generally speaking, that parasympathetic division, the craniosacral division, as far as the cranial nerves, we have the oculomotor nerve, the facial nerve, we have the glossopharyngeal nerve, and the vagus nerve, all here. Their preganglionic neurons are located for the parasympathetic division in the brainstem, nuclei, and the S2, S4 segments of the spinal cord. So you're looking at basically down right in here, okay? The functions are to bring the body to homeostasis and by conditions of rest and digest, and conserve energy and replenish nutrient stores. Here you can see the pelvic splanchnic nerves down here. This information you're seeing here, the visual component here, up here, you will not need to know for your exam. I want to always tell you that, so we'll tell you what's on it. Sympathetic division, the thoracolumbar division, the origin, the preganglionic neurons are located in the lateral horns of T1 all the way down to L2. Okay? Remember, they can be either anterior or lateral to the vertebrae or to the spinal cord. And that said, they're in the thoracolumbar area. Their functions are to bring body to homeostasis in conditions of fight or flight during times of stress, and increased alertness and increase in metabolic activities, at least to some extent. Now, you will need to know, so these little visuals here for the parasympathetic division, for the ganglion, and the sympathetic division, you might see a diagram or two in that regard. And for here, for the parasympathetic, we'll go a little more here. We have the preganglionic neuron here, the long preganglionic axon, the ganglionic neuron. Here's a short ganglionic axon here, and the autonomic ganglion is close to or within the effector organ wall, where the terminal ganglia and the intramural ganglia exist. Sympathetic division, our preganglionic neuron, and we have short branching preganglionic axon here, branched out. And then we have a long postganglionic axon from the ganglionic neuron here, with the autonomic ganglion close to the vertebral column, the sympathetic trunk ganglia, and the prevertebral ganglia. As far as degree of response, for parasympathetic activity, it's fairly localized. The long preganglionic axons with limited branches influence only one or a few effectors at the same time. The sympathetic activity often facilitates mass activation. These short preganglionic axons with many branches simultaneously influence several effectors. Exercise or fear can stimulate changes in many of these organs, in many different organ systems, which makes sense, right? During times of stress, you have to heighten a lot more, not just a little bit of your body to be going into gear, essentially. Sympathetic stimulation, the release of adrenal medulla hormone facilitates this mass activation. Sometimes, however, a single effector can be engaged, sometimes. Sympathetic activity triggering a pupil dilation in low light, something of light stress, right? No pun intended there with low light, but something that's very light stress, you may have a single effector, but for the most part, you're expecting much more of a mass activation with sympathetic activity. So what did you learn? The parasympathetic division is responsible for what main functions? Describe the general anatomic differences in parasympathetic and sympathetic divisions, and what's the difference between the degrees of response for the parasympathetic division and the sympathetic division. And we'll stop there. Again, a very brief video. We'll try to keep it brief for you, and we'll go on to section 15.3 here in a moment.